Welcome everyone to today's webinar, where we will be discussing the survey results from a survey conducted on COVID-19 and communication accessibility and the impacts on people who are deaf, blind, and hard of hearing. Before we begin today, I'd like to start with some housekeeping items. Today's webinar is fully accessible for those who are deaf and hard of hearing, and we have closed captioning and sign language interpretation available. We'd like to remind you to use the gallery view in the view section so that you can see the speaker, the slides, and the communication access at the same time. For those of you who wish, you can also access the stream text to be able to see the captions on a separate screen, and the link for the stream text is in the chat panel. This webinar comes with a number of different functions. If you have a technical issue, please use the chat function and one of our team members will be able to assist you. During the question and answer period, we will look at the different questions from the Q&A box to be able to get your questions and respond to them. First, before we begin, I would like to begin by acknowledging the Indonesia's people of all the lands that we are on today. While we meet today on a virtual platform, I'd like to take a moment to acknowledge the importance of the lands which we all call home. We do this to reinforce our commitment and responsibility to improving relationships between nations and to improve our own understanding of the local Indonesia's peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuits, Mets, and First Nations people that call this land home. Please join me a moment on reflection to acknowledge the harms and mistakes of the past and to consider how much we can, each in our own way, try to move forward in a spirit of reconciliation and collaboration. I'm just going to pause for a moment. I think there are a couple of technical issues in the chat, so we'll just have those corrected before we move forward. So today we are very pleased to bring together, through a partnership with the Canadian Hard of Hearing Association, Wavefront Center for Communication Accessibility, and the University of British Columbia, to discuss a survey that we did on the impact of COVID-19 on people who are deaf, hard of hearing, and deaf-blind. We know this past year has been very devastating with the global pandemic, and we wanted to better understand the impact of this pandemic on the various communities that we serve. So working together with the Canadian Hard of Hearing Association, University of British Columbia, and our research department here at Wavefront Center for Communication, we conducted a national survey. And today, we're very excited to be able to share some of those results with you. Today's webinar will consist of our two speakers, Dr. Brenda Poon and Dr. Lorianne Janstead, who will be providing a presentation. And then Lee Pagu, the National Executive Director of the Canadian Hard of Hearing Association, will give some closing remarks and will be able to close the day with some questions and answers. Thank you. And now on to Brenda and Lorianne.
Hi, everybody. I'm really pleased to be here with Lorianne and our partners to share some of the results of our survey that was distributed earlier this spring on the impacts of COVID-19 on communication accessibility for adults with hearing loss. As Chris mentioned, there have been so many impacts on our lives, on our home and working lives over the last year and a half. And we really wanted to learn through this survey some of the experiences of our deaf and hard of hearing communities and how individuals have really managed to stay connected with their networks and also keep up to date with key information and also guidelines, as they have been changing very rapidly. So before we get into the results themselves, we wanted to provide some additional information and background about the survey in itself and its purpose. So the general purpose of the survey was really to collect information on the impact that the pandemic has had on the day-to-day lives of people who experience hearing loss and deafness. And we had a particular focus here on accessibility, communication accessibility, and access to information. We hoped that this survey would help us better understand not only how the pandemic has been experienced, but also how accessible that information has been, that information about the virus and the disease. And the hope is that we can use this information to develop strategies for how best to deliver it to the public. So how did we do this particular study? Well, we partnered and developed a questionnaire together and administered an online survey. The survey link was sent to the Canadian Hard of Hearing Association membership and also Wavefront Centre for Communication Accessibility members and clients. Each question was not only in written format, but it also included an embedded link to a video with translation of the question in American Sign Language. In terms of the topics that were covered in the survey, we asked participants questions about how they got information about COVID-19, ways that COVID-19 health and safety measures have influenced communication accessibility. And also just in terms of ways that participants have been affected in their day-to-day lives. Now, who responded to the survey? Well, we delivered this link and the survey was made available for about 10 days at the end of March and early April. In terms of who responded, well, we were so pleased to see the response to this survey. In total, we received 656 completed surveys. And, you know, this wasn't a short survey. So we really appreciated the number of people who completed it and submitted it. And although we built in a number of multiple choice type questions, we also invited a lot of responses through open-ended questions. And we're inviting people to write their responses. And what a response we got, several hundred written responses to multiple questions across the survey. So just an indication of the experiences that people wanted to share with us through this survey. So we're very appreciative of that. In terms of the composition of the respondents themselves, for gender identity, the majority of our participants, 60%, identified as male, 39% identified as female, and 1% identified as other. Now, with respect to age category, they really fell into two categories. So predominantly in our 51 to 70-year-old range, as well as our 71 to 90-year-old range. Between those two groups, that covered about 82% of our respondents. Oops. Just click back for a moment. There's just a delay in seeing some of the menu options here. Okay, great. Further about demographics, in terms of how respondents self-identified, we can see through the numbers here that the majority are self-identifying as hard of hearing. And in terms of the primary mode of communication as well, the majority were stating that it was speaking as the primary mode. Now I'll tell you a little bit about the topics themselves and what we'll share with you today in terms of the results. There we go. So in terms of our three main topics, what did people tell us through this survey? Well, today we'll present an overview of just a snippet. So selected findings that really span across these three major topics. So first of all, how is information accessed about COVID-19? And what could be improved in conveying that information? A second area that we'll talk about today is around ease of communication, especially with protective measures in place, such as face masks and plexiglass barriers, and when using different kinds of formats like video calling. What was easy? What was difficult? We'll also speak a little bit about ease of communication while using different types of services. And the focus today will really be on results in relation to general medical services. And finally, we'll also share with you what we heard from respondents about some of the challenges experienced in various day-to-day settings. So whether that was at work, school, grocery shopping, or using public transit. So with that, I will turn the screen over to my co-presenter, Lorianne.
Okay, thank you, Brenda. So I'll start by talking about how people access their COVID-19 information. We wanted to know where people were getting their information from. So survey respondents were allowed to choose as many options as applied. So you'll see that numbers add up to more than 100% here. So these are all of the options we gave people to choose from in terms of how they got their information. And you can see that almost 80% of respondents received their information through news briefings in video format. This was followed by media releases in written English language, then followed word of mouth. We all get a lot of our COVID information from our friends. And about, this was followed, as you can see, by newspaper, social media, and then various other forms, including the doctor or their employer. So we wanted to know how easy it was to understand the information received through these various formats. And so I will show you that for the most common option chosen, so news briefings in video format, since that's fairly universal in terms of how people got their information. So this slide shows us how easy it is to understand COVID information through news briefings. We decided to display the results by degree of hearing loss from mild up to profound, because we thought that ease of access might be different for different degrees of hearing loss. So the bars on this chart show the percentage of people, we'll go with moderate hearing loss. So the percentage of people with moderate hearing loss, for example, who found it very easy to understand the briefings, somewhat easy to understand the briefings, neither easy nor difficult, somewhat difficult, and then at the top, just 1% of those with moderate hearing loss found it very difficult to understand the briefings. So overall, across all participants, about 3 out of 4, or 75% of respondents, found that the information in video format is easy to understand. But the story is a little bit different for severe and profound hearing loss. So for those with profound hearing loss, about 21% find it difficult to understand the COVID information through these news briefings by video. We also asked people to tell us how all of these sources of information could be made easier or more accessible for understanding. And people gave us a lot of responses, which we very much appreciate. And the ideas fell into 3 different categories. So making the information itself more accessible, making the communication accessibility better, and also providing multimedia. So for example, under information, people suggested a streamlined approach for federal, provincial, and local COVID-19 information that would be consistent across all of those platforms. For communication accessibility, people asked for captioning that was accurate, easily visible, and consistently used and consistently embedded in all live and recorded sources. So one respondent to the survey, I like how they put it here, so we'll use their words. They said, mandate all television broadcasters and news outlets online to provide 100% accurate closed captioning and always have the sign language interpreters visible without any overlay covering them. And the final area for suggestion was multimedia. And the suggestion here was to have multiple modes of getting the information. That could be through mailouts directly to people's homes, online information, email, face-to-face through a healthcare provider, and also massive media campaigns with consistent information across all of those sources of information. Okay, turning next to how face masks affect communication. I think this is something that we have all found to be a challenge this year. And so we asked, how easy is it to understand others who are wearing face masks? And again, we decided to display the information by degree of hearing loss. So from mild up to profound. And what we found was that at least half of the respondents for each severity of hearing loss have difficulty understanding others wearing face masks. So for mild hearing loss, 44% find it somewhat difficult and 11% find it very difficult. And we can see that easiness goes down with greater degrees of hearing loss and difficulty goes up. So for respondents in our sample who had profound hearing loss, about 3 out of 4 of them find it very difficult to understand others who are wearing face masks. Similarly, we asked about how easy it is to understand others who are behind plexiglass barriers. And the results are somewhat similar here. we found that more than half of our respondents with moderate, severe, and profound hearing loss have difficulty understanding others who are behind those plexiglass barriers. And for those with profound hearing loss, it was about 1/3 of the respondents find it very difficult. And more than half of those with profound hearing loss find it difficult or very difficult to understand those behind plexiglass barriers. So then, because we are always interested in solutions, we asked what would help make communication easier behind face masks, behind plexiglass barriers. And we gave people several options to choose from in the survey, and we asked them to rank which of these would make it easier for you to communicate with others. And so the responses came through. If someone is wearing a face mask, it would be easier to understand them if they speak louder. That was the top choice that came through. If they could speak more clearly, if they could speak slower, and then if they could step back to a safe distance and lower their mask to speak without the mask covering their face. And finally, use a clear mask that allows for the facial cues and the lip information to be visible. There were some similar suggestions for being able to communicate easier if you're behind a plexiglass barrier. And the suggestions were, if others could speak more clearly. We'll see some of these suggestions are similar to the face mask suggestions. Next was speak louder. Next was step out from behind that barrier and speak from a safe distance, because safety is still important here. Next was speak slower. And finally, write down the information that's trying to be conveyed. One of our participants said, clear masks, flexibility of brown masks, plexiglass barriers, willingness for staff to write down questions, more public education, as I was judged a lot for not understanding. So there's a lot of information that that participant volunteered. Next, we asked about how easy it is to understand others during video calls. A lot of us have transitioned from in-person conversations to video conversations. So we wanted to know how easy or difficult that was. So similar kind of graph as before. We found that at least 64% of our respondents made at least 3 video calls per month with friends or family. So that's the majority of our respondents are familiar with this mode of communication. We found that for those with severe or profound hearing loss, they reported that they understand 50% or less of a video call. So they're only getting maybe about half of the information through the video calls. And that would be low understanding or no understanding. In terms of what could be done to improve communication through video calls, some of them were technology solutions and others were behavior solutions. So the top choice was microphone quality. Second choice was having captioning available. Then internet connection. I'm sure we're all familiar with when the internet drops out or gets slow, that makes the communication challenging. In terms of behavior, the speed of people talking, if people slow down a little bit, that's going to help the communication go easier. And finally, video quality, allowing us to have access to visual information as well. And so I'm going to turn it over to Brenda to talk more about access to remote medical care.
Thanks, Lorianne. So when considering communication accessibility, we also ask participants sets of questions about their experiences, and particularly the experiences of using remote health services. Now, one type of remote health services that was widely used was remote general medical care. And we found that 78% of respondents used remote medical care. So that is via a video call or a phone call. And overall, across participants, we found that about 2/3 of all respondents found it easy, somewhat or very easy to access that medical care remotely. However, that wasn't the same across different degrees of hearing loss. So according to this bar chart here, for example, you can see that for those in the mild to moderate categories of hearing loss, it is easier in terms of accessing medical care according to the survey responses. So we're seeing that those that reported very easy to somewhat easy have higher proportions, are experiencing easier access to medical remote settings than those that are in the severe to profound categories. So you can see how there's a decrease in percentages as you go by increasing degrees of hearing loss. So overall, we found that about a quarter or 1 of 4 respondents with severe or profound hearing loss reported some level of difficulty accessing remote medical care. Now, despite the challenges that could be experienced through this mode of service provision, we still found that the majority, 70%, reported that they are still likely to use remote medical services again, even after the pandemic is over. So some indication there that there is some desire for virtual services in this setting. Now, mentioned that there were challenges. So what were some of the difficulties? Well, I think the primary theme that emerged from our results can really be reflected in the quote at the bottom. So from one respondent, we heard, "All the virtual medical appointments, 10 plus I had, were telephone. Video option would be much easier for a lip reader. Telephone appointments were almost impossible, and I can't exactly be sure what was said." That was really a primary theme that emerged in our data, in that the recommendation was that video meetings should be consistently offered as an option for virtual medical appointments. And this didn't happen always because some offices only offered appointments by telephone, and that made clear understanding of the talk between a physician or healthcare provider and the patient much, much more difficult. Now, for those who were using or did have access to a video appointment or video call, there were sort of a top 5 list of improvements that could be made. And you'll see from the 5 listed here that there's a lot of overlap between the recommendations that were made for video calls that Lorianne referred to and those that were referred to for general medical services. So you'll see again that the top 2 recommendations are around having captioning available and also having better microphone quality. So we also asked participants not only about use of medical services, but we wanted to know more about the impacts of the pandemic on their day-to-day lives. So this is where, in the part of the survey, we asked participants to respond to a couple streams of questions, open-ended questions. And the first stream was really about telling us more about any difficulties and types of difficulties experienced. A second stream was to ask participants to tell us what could have helped them through these difficulties. So we analyzed these data, which again were really the written responses of participants in this case. We asked these questions and we identified through the analysis some key themes that were emerging. And this is a set of themes about the types of difficulties around employment experiences. And generally speaking, we found a quarter of respondents, so 1 in 4, reported some difficulties in employment. And that could have been around reduced employment hours or reported job loss. And a primary reason for difficulty was really around the top theme here, around business slowdown or shutdown, and employers having really reduced employment hours to offer. And also in the more extreme case, layoffs and terminated contracts. Now, respondents also told us about difficulties associated with change needs and hiring practices of employers. So there was a lack of new hires, for example, and there was also a tendency for lack of retention practices. There were cases where there were shifts from, let's say, part-time status to casual status, which was causing some difficulties for some of our respondents. And finally, a third major theme in terms of difficulties were really those stresses associated with being in the workplace itself. So respondents told us about communication being difficult, particularly when you have coworkers wearing masks, and also the challenges of being in workplaces where there wasn't a use of clear masks. So in the words of some of our respondents here, it was difficult to hear lip read in the workplace. I cannot understand my coworkers with their masks on. The stress of not being able to lip read, and the workplace refused to obtain clear masks. Now, there were also recommendations put forward. And one theme around the recommendations was around the desire for more employment-related supports. And these could have been fall into the category of those things that helped respondents as well as those things that could have helped. So in the case of income supports, those were supports that were viewed as helpful. In terms of a call for more supports, there was a need for improved communication access and support. And the examples that were provided there were around captioning, and another example was better FM system. Now, in addition to employment-related supports, we also saw there was another theme of types of supports needed. And that was around health and safety measures. So there was suggestions put forward for the need for clear face masks, as we've heard before, the need for social distancing in the workplace. And I'd say a key theme that came out in the text data was also the need for employers to have better enforcement of those measures. So consistent use, and the lack of consistency was noted by our respondents, and this was a part that was really highlighted, I'd say, by multiple respondents. If we look next at educational opportunities, well, as a result of the pandemic, about 1/3 of our respondents overall reported some challenges associated with education. And that could have been either reduced educational opportunities or altogether withdrawal from school or classes. And we see here a number of reasons for the difficulty. First and foremost, at the top was really the reduction in in-person programs due to cancellations, and just that there were no more in-person classes available, whether that be educational or recreational. So along with the reduction in in-person programs, at the same time, we saw that there was an increase in virtual learning opportunities. But with that, raised by our respondents were a number of challenges associated with virtual learning. Generally speaking, it was harder to follow audio-focused classes, difficulty to understand instructors. It's an overwhelming experience for some, stressful. It was a sense of format that was tied with a bit more boredom. And there was also the aspects of accessibility in terms of no captioning available or interpreting services or recordings or transcripts. And we see that in the words themselves of our respondents, with a few examples here around no captioning, poor captioning, access to recordings. And I think the third point here about the overwhelming aspect of virtual learning for some. From one respondent, we heard, I am in classes online, and to read my CART services, the chat, take notes, and see the instructor's lips was overwhelming. There should be no chat box use in classes, according to this respondent. So what were some recommendations put forward? Well, in terms of what could have helped, there were a couple different categories. Learning supports. So if possible, and if it can be done safely, providing more face-to-face learning in person if possible. Having more local supports available. So the idea of having tutors or tutorials would be very helpful. And I think we found in post-secondary settings, there was mention of the helpfulness of accessibility services. A second major theme in terms of what could help was around virtual learning. So ways to improve communication accessibility, not only in real-time formats, so live formats, but also in recorded formats, and the call for captioning across the board. About that overwhelming nature of multiple inputs. So are there ways to reduce that overwhelming nature of multiple simultaneous communication channels? And then there's the technical aspects. So are there ways to address those technical issues? Ways to ensure better quality audio video, for example. In terms of other day-to-day types of experiences, we also asked about grocery shopping and getting food on a day-to-day basis. And we found that about a third, more than a third of respondents reported some difficulties obtaining groceries or food as a result of the pandemic. And the types of recommendations that we heard from our participants really clustered around three major areas. So the first one was really about expanding and improving online shopping and delivery options. The idea that more businesses should increase their capacity to offer online grocery shopping and delivery services. So not only that, but also increase the affordability of those services and quality in terms of making it more reliable, having more options for payment, for example. A second major recommendation was to support for businesses to better support clear in-store communication with customers. So having more visual clues, written text to guide customers. So we've seen that there are visual clues now in aisles. There was a call for more in terms of helping to direct customers through to cashiers, maybe having flashing lights or utilizing those to be able to streamline the process for customers to get to the cashiers. Also a call for more training for staff within these businesses and generally greater public awareness on strategies for communicating with masks and plexiglass barriers. Some of the tips that Lorianne had mentioned earlier as well. And third, are there ways that we can better ensure that stores are meeting public health and safety guidelines? So again, that idea of stronger enforcement, also limiting number of customers, for example, ensuring proper mask wearing, sanitization, more aisle space, and also offering, for example, more reserved shopping times for seniors. And another area related to day-to-day living, one that affected more than 40% of our respondents was around the difficulties in traveling on public transit. So we know that there were there was hesitation to really take public transit. And one of the primary reasons for that really was this top point here, the top theme, which is fear of becoming infected and just not feeling safe in that setting. So a fear of others not respecting guidelines, the lack of enforcement, again, of those safety measures. A second major theme was also around difficulty in understanding others. So it was difficult to understand bus drivers who were behind plexiglass barriers and also wearing masks, as well as those were like SkyTrain attendants as well. So understanding staff people with transit was very difficult, and it was also hard to hear announcements at times. As one respondent put it, "I can't read lips with masks on. People still talk to you when you say you don't understand." So expressing some frustration around that experience. And there are also reports around the impacts of reduced transit service when there was reduced capacity. So inevitably that is associated with more wait time for service. And as we heard for some respondents that had additional needs, disabilities, that could cause discomfort. And for some in this case, pain. A passenger limit restriction caused a lot of time waiting. With a disability, this was painful. What were some recommendations moving forward to address some of these difficulties? Ones that are consistent with some in other public settings. So that enforcement of those measures, cooperation amongst the people involved, staff, as well as greater public awareness, having the mandatory masking and social distancing, having that enforced. Again, the idea of clear face masks, and quality face masks, effective face masks. So having increased use, anti-fog, full visibility so that lip reading was easier. The inclusion of more signage, making it easier to guide customers. And also better ways to facilitate social distancing. So that idea of continued reduction in the number of people taking transit at a time. And that idea of expanded transportation options as well. So more specialty buses and vehicles available for particularly the group of people that have additional mobility issues and disabilities. So that is really a snapshot, a selection really of some of the survey results, a bit of an overview. I'll just click ahead here. In terms of next steps, we did present the selected findings today, but we also are preparing a summary of some of those key findings from the survey, an overview that would expand beyond what we talked about today. So if you are interested, please do stay tuned for that report as well. And finally, just to close this segment of the webinar, we just would like to thank all the participants who took the time to complete that survey and share their experiences and perspectives during such a stressful and challenging time. So just greatly appreciative of you all taking the time to do that. Thank you to our sponsor, the project sponsor, the Canadian Hard of Hearing Association National. And definitely to our partners who've worked so closely with us on this particular project. So looking to those past and present members of our audiology department and our marketing and communication department at Wavefront. A special thanks to Yat and Jenny from Wavefront and Gordana from CHHA for working together with us and reaching out to connect the survey to so many members and clients. So thank you all so much. And with that, I will turn the mic over. Thank you.
Thank you, Brenda, and thank you, Laurie. That was tremendous amount of information you just presented, and I know that you said it was very brief, but I know that people today gathered so much information and really looked at all aspects of people's lives. So before we move it on, I just want to remind people that we will be doing some Q&As, really particular to the data and some of the things today. So if you can put those questions in the Q&A section, we'll get to those. Right now, we'll pass it over to Lee.
Thank you, Christopher. And thank you, Dr. Poon and Dr. Genstead. This partnership with Wavefront Centre and the Canadian Hard of Hearing Association to conduct this survey allowed us to gather this valuable information from people across Canada. The impact on this pandemic has had on the daily lives of people who are deaf or hard of hearing is now quantifiable. We want to thank everyone who took the time to participate in the survey and to all of you joining us today on the webinar. This response has been amazing. The questions asked in the survey spoke to the everyday, the practical aspects of thriving in this pandemic and the lockdowns. The top 5 responses and recommendations for improving communications, whether they are simple behaviors or improved technology, are all doable with small changes in attitudes, kindness, and perhaps a little bit of education. So thank you to all of the respondents and our participants. And Dr. Poon and Dr. Genstead for your research and summarizing everything so very well. As mentioned, there will be a final report, which we will post on both of the websites for Wavefront and the Canadian Hard of Hearing. Along with this webinar, will be on YouTube and in the Canadian Hard of Hearing webinar section on our website. There are also many other valuable resources for the hard of hearing community, so please connect with us or Wavefront on ways to share this information with your employees, colleagues, local stores and retailers, or any other services you are trying to access. The information is easy to understand for everyone who cares about those who are in front of them. So thank you very much. And we'll turn it over now for questions and answers.
Thank you, Lee, for that. So I see a number of questions that have come in the Q&A box, and I'm sorry, it's very difficult to monitor the chat box. So if you put a question in the chat box, I would strongly suggest you put it in the Q&A box. Some of the questions may not be appropriate or not easy to answer during this session because they're looking at solutions and so forth. We might have to do some follow-up with some of that. I think one of the first questions I looked at here, and this is to either Brenda or Lori-Ann, the survey results are interesting. Are there any thoughts why women participate to such a larger extent?
I'm not sure why we got a higher response rate for the survey. And thank you to those in the chat, I think, that highlighted my crossed vision, I think, in reading the particular graph of the pie chart. I think I had reversed the gender participation on the survey itself. Yes, we did have more women participating than men. And I don't know if there's a reason that I can put forth about why we would have had greater participation. Lori-Ann, do you have an idea?
No particular thoughts. I think the split was 60% women, around 40% men. So it is close to a gender balance. And yeah, I can't think of anything off the top of my head that would explain it simply. Mm-hmm.
Thank you for that. Just scrolling through some of the other questions here, a number of them are asking about recommendations of accessing either technology or other accommodations. So I'm not sure this is something that either Brenda or Lori-Ann want to address today, or if it would be appropriate to do so. Just looking at the questions, maybe Lori-Ann, as an audiologist, you might want to focus on this, and if you don't, please say it as well. Are there any types of headphones that you recommend to wear over hearing aids?
Specifically, ones that go fully over the hearing aids are probably going to be better than ones like what I'm wearing. But I would also recommend talking with your audiologist. I think one of the other questions in the chat was around Bluetooth connection from the device to the hearing aids. And so many hearing aids are going to have ways to connect directly to your tablet or phone or computer. And that's going to be individual for your hearing aids. So I recommend having a conversation with your audiologist about what is going to work best for you and your hearing aids. You may be able to have that conversation remotely. You don't necessarily need to go in person for that. So that's what I would recommend. It's going to be an individual solution for you.
Thank you for that. And I see a lot of other similar questions that are really more facilitated or focus on individual accommodations that would be required. And I think, as Lorianne mentioned, a lot of this, you would probably want to have a discussion with your audiologist or a service provider if it's provision of captioning services or interpreting services and so forth. So maybe this is a question that we can throw out here as well. So given the solution-focused perspective that is being taken, do you have any recommendations as to what information individuals are looking for employers to better understand in regards to accessibility in the workplace?
Brenda, do you want to answer that?
I'm thinking in terms of, if I'm understanding the question correctly, that idea of better enforcement of measures and also flex at the same time, consideration of needs in terms of like the clear masks idea. So how to safely promote communication, but also still stay consistent with the public health measures as well. I'd say that the clear masks was something that came across in multiple settings. And I think if they were brought forward, they weren't necessarily receptive to the idea to use them in all different types of contexts, even though efforts were made. There was a bit of not necessarily acceptance of using them right away, whether that was in businesses or workplaces. So I think there was a call for wider use of them, and also if they were being used within various settings to try and improve on actually, you know, the visibility component of them, and also that idea of quality in terms of the fogging up nature of it too was mentioned as well. But I think that there was still the call repeatedly around workplaces being safe, but also ways to be accessible. So having, you know, captioning available depending on what setting it was, the better quality assistive listening devices, and then with the public health safety measures, improving the quality of having, you know, the masking to keep people safe, but also promote communication access.
I see a lot of conversation about the use of clear mask, whether it's in a healthcare facility or whether it's in a place where you're accessing services such as a bank or so forth. Is there any idea why do you think there's such reluctancy to use a clear mask?
You know, honestly, I was surprised when I saw the text responses saying that there was sort of resistance to them. Actually, I was caught off guard that, you know, people said that they were encouraging use or even use them. and they weren't permitted. And I think part of the reason, I think from a consumer's perspective, I guess, is that they would enter a business, and the business wouldn't allow them to use the mask in their place of work because there was a belief that maybe it didn't meet with safety guidelines. But it was puzzling to me to see that within the open text responses, actually about both from a workplace perspective of not accepting them within the workplace, and also for those consumers going into businesses and finding resistance to them as well.
And I'll perhaps add on to that. I know particularly early on, some of the clear masks were not very good. And I see Lee has some information too. So some of the early clear masks weren't actually occluding. So they would just be a little, almost like your own personal plexiglass screen that would allow spittle to be transmitted still. I know some of the clear masks also fog up quickly, and so then it would even be difficult to, you're still not getting the visual information. And the final response I have, and then I'll turn it over to Lee, is that sometimes the acoustics behind those clear masks are worse. And so it can be harder to understand someone behind the clear mask, and the cloth mask can be easier for transmitting the sound. So it's a bit of a trade-off between seeing and hearing in that case. And Lee, go ahead.
Yes, thank you. The Canadian Hard of Hearing Association works with the Como Foundation for My Access masks, and they are medical grade. They're in many schools across Ontario and Alberta. They're washable. They do work well. I use mine almost every day. And I've never had a business or a service say, you can't wear that. They come in a lot of designer colors too, so they're a lot of fun, and they're big enough. Unfortunately, I don't have mine. Mine's in the car right now. But they're washable. Again, I use mine every day. They're available on our website at shopcha.ca, and take a look at them. I've been using mine for about 6 months now, and I have two. One's at the office and one is here in my car. And nobody's ever said anything except very positive things about it. They look very robust. They allow for free lip movement, and they don't chafe. Like sometimes the cloth masks will do that. And I've had a lot of people, whether they have a hearing loss or not, say they appreciate, because then they can hear what I'm saying and share my smile while I do it.
Well, thank you for that. And we just actually had a moment ago, our captions disappeared. It seems to be some internet difficulties for the captioner. But that concludes our webinar for today. Again, we'd like to thank everyone for their participation in the survey and on today's webinar. And a heartfelt thanks to all the work that Brenda and Lorraine have both put into this. I know it's been a lot of work, and I think it's showing some really fantastic data and great results. We've seen a number of other surveys come out the past year on other communities to understand how the pandemic has impacted them. So this has been very good for our communities. Again, we'd like to thank everyone for their attendance today. And as mentioned before, there will be some follow-up materials in the next several weeks explaining this data in more detail. Thank you and have a great day.